Good evening, everybody. Hi, my name is Dr. Serena In, and I'll be the moderator and host for this session. With me here, I have my colleague, Ms. Cheryl Tam, and we are both lecturers and clinical psychologists who will be part of the faculty of the Master of Clinical Psychology in IMU. So today, yeah. So today we're so excited to have a dialogue session and to have Ms. Cheryl really break it down for us on the various career pathways for what we can do with a Master in Clinical Psychology. Okay? So before we proceed, I'd like to cover some housekeeping rules. Firstly, we have muted the microphone for all attendees to ensure a smooth session. Secondly, if any of you have any questions or feedback for us, please use the Q&A panel that you can see in your screen. We will address the questions towards the end of the session. And please take note that this live webinar will be recorded. All right. Okay, so once again, for those of you who just joined in, thank you for spending your 1 hour of your precious time this evening with us. So without further ado, I'll pass the floor over to Ms. Cheryl Tam, who will bring us through the career paths with a Master in Clinical Psychology. Over to you, Ms. Cheryl.
Thank you, Dr. Serena, for the warm welcome. And again, I would echo what Dr. Serena has just said. Thank you so much for spending your precious time with us this evening. So, right, let's cut to the chase and zero in on today's topic, which is what we're all here for today. So, I will start off briefly talking about the overview of the profession. In one moment. Overview of the clinical psychology profession, and then I will also segue into talking about how one comes about to become a clinical psychologist in Malaysia, and we'll also go on to talk a little bit about the Masters of Clinical Psychology program at IMU, and later on also talk about a bit more about the potential work setting, and also share some of our personal insights and observations about the industry. Yeah, so it's noteworthy. Before I start, I just want to put it out there that much of what I'll be talking about today will be focused more on the local context in Malaysia. Yeah, so along the way, myself and Dr. Serena as well will share our observations, as I said earlier, and our insights about the industry. So hopefully this can help shed some light and give you all more insight if you're considering to pursue a career path in clinical psychology, or maybe some of you are already in training and headed this way in your career. Yeah. So very quickly, let's go through some of the quick overview of the profession. So what exactly is a clinical psychologist? So this is directly from the Malaysian Society of Clinical Psychologists website. So it says here, a clinical psychologist is a psychologist who is a specialist in mental health. They have undertaken specialized training in the assessment, diagnosis, formulation, and psychological treatment of mental health, behavioral, and emotional disorders across the lifespan. All right. So what would be the scope of skills that a clinical psychologist would possess? So again, also from the Malaysian Society of Clinical Psychologists website. So one of the fundamental core skills, we call it, would be in the area of assessment and diagnosis of mental disorders and also psychological problems. So clinical psychologists are trained and equipped in the area of using psychological tests, yeah, to assess across several areas. So typically in the area of psychopathology, yeah. So clinical psychs are trained to use a variety of assessment tools to help assess our clients' functioning across several domains, yeah. And usually we call it, we don't just use one, we use multiple ones. We usually call it, a test battery or an assessment battery that looks across several areas of functioning. So some examples maybe you've read or heard of before. Common area would be like intelligence, yeah, personality, general behavioral measures, yeah. So the whole purpose of assessing, yeah, is to find out and have a better understanding, paint a better picture of what a client is actually experiencing, what are their areas of difficulties, and hopefully with that better understanding, to be able to treat psychological difficulties more effectively. Yeah, so assessment and diagnosis is really a very core skill and in clinical psychology. Yeah, and it comes with that would be treatment, or we may also refer to that as intervention. So clinical psychologists also use a variety of techniques and therapies. When I say therapies, they're psychological therapies to treat mental disorders. So there are a variety of evidence-based approaches in treatment that are some are better known to be effective in treating certain other psychopathologies over others. Yeah, so that also is usually guided by research, right? So clinical psychologists would typically possess the specific skills to help manage complex problems in clinical psychology that requires, individualized treatment, right? So the third skills moving down would be in the area of learning. Yeah, so when we say learning, we are also referring to the area of teaching, research, and also assessment. So these are essential to being a clinical psychologist. So earlier I did mention about treatment or intervention approaches that are evidence-based. And we say evidence-based, that means there are research backing to it. Yeah. So a lot of times, what would be the common areas of interest when it comes to research would be assessment, diagnosis, prevention, and also treatment, right? So these three would be the so-called fundamental skills that most training programs would focus on, and a qualified clinical psychologist should be competent at delivering, right? So that's a bit on the of an overview on the profession. So let's move in to talk about pursuing a career in clinical psychology. So right, so if you're interested to go down this path, how can one actually come about becoming one in Malaysia? Yeah, so typically a bachelor's degree in psychology is needed, right? But the specific entry requirements, I should emphasize here, may vary from program to program. Yeah, and usually programs that are accredited by MQA, which is the Malaysian Qualification Agency, which is a statutory body, yeah, that accredits academic programs offered by higher education. Yeah, so most clinical psychology programs in general that are accredited by MQA would have to adhere to certain standards. Yeah, we call it the program standards for psychology. So there are general guidelines as well about the entry requirements for a student to be admitted into a Masters of Clinical Psychology program. However, the specific entry requirements may still vary from one program to another program across different institutions. So earning relevant internship or work experience would also be helpful, but I also must emphasize that not all programs have this as a compulsory or mandatory entry requirement, but it does give, it may give an applicant a competitive advantage. So bearing in mind, if you've done your search about programs, Masters of Clinical Psychology programs in Malaysia, typically there are limited seats, right, for each intake. So that also means that usually programs would take candidates, applicants that are deemed to be most suited for the program. So it is competitive to get in, and having this kind of relevant internship or work experience, or sometimes even voluntary experience, may be helpful. So engaging in research projects that are relevant to this area of work may also be helpful. Again, not all programs have this as a compulsory entry requirement, but similarly, it also gives an applicant, it may give an applicant a competitive advantage. So, when we talk about research projects, I'm actually referring to, at an undergraduate degree level in psychology, typically in the final year, some programs will call it a thesis component, sometimes it's a final year project, or sometimes it's just additional effort beyond your formal curriculum. So if there's some kind of experience surrounding doing projects that are relevant to the field, that also typically shows graduate programs that, hey, you've really thought through your career option, and you're actually serious about getting into the field. Yeah. So after all that, of course, obtaining a master's degree in clinical psychology, at least, so this is the minimum requirement to be able to qualify as a clinical psychologist locally, right? And when we talk about a master's degree program in clinical psychology, I'm referring to the ones that are provisionally or fully accredited by MQA. Yeah, so because this would have a rather direct implication on your registration afterwards. So registration with the Allied Health Professions Council would be needed. So this is something that is rather new to the profession, I would say. So the registrations have only started rolling out in recent times. Yeah, but for applicants who are, just getting into the program or current trainees, most likely by the time you graduate, right, this would be a requirement. So by registering, that will also lead to a practicing certificate being issued, and it is valid for 2 years. So I won't get into the exact technicalities about registration. I think that is a different platform, and it would take quite a bit of time to explain through everything. So if you're interested, these would be the websites that you can visit to have further information. Serena, as I'm talking, it would be helpful if you could help extract the websites as well and share with our audience. Yeah, thank you so much for
Thank
that.
you.
Okay, great. Right. So those are our general pointers about, really pursuing a career in terms of your education background. Yeah. So please allow me to segue a bit into the program at IMU. So we've received MOHI approval to run the IMU Master of Clinical Psychology program commencing 1st August. So this was last year, about a year ago. And we are launching our first intake in September 2023. So we've taken a year to really look into the specifics and making sure that the program is solid by the time that we launch. And we are proud to say that, it's happening September. So the program has received provisional accreditation status from the Malaysian Qualifications Agency. I've mentioned it multiple times now. So it's something that is important, right, for higher education programs like that. Again, as I said, it would have a direct implication on how our graduates' qualifications would be recognized afterwards. So graduates of the IMU Clinical Psychology program will be eligible to apply for registration with the Malaysian Allied Health Profession Council, which again is something that will be mandatory moving forward in this profession, and also the Malaysian Society of Clinical Psychology. So if you've read further about MSCP, then you'll understand that MSCP is a professional society, right? Consisting of like-minded professionals. Well, it is not mandatory to be a member of the society in order to practice, because again, with the Malaysian Allied Health Professions Council coming into full swing, that would be the main regulatory body, right? However, this is just speaking from experience and observing what's going on in the industry. Most of us would like to be a part of the professional society, simply because it's a way to network, get to know each other, receive the support needed to really thrive and move forward stronger as a profession as a whole in Malaysia. Yeah, I'll get to that later towards the end of today's session. Yeah. So very quickly, this is our program overview. It's a 60 credits program running across 2 years. And we are in compliance, with what is set forth by, or at least we really put in our effort to ensure that we're adhering to it. Yeah, it covers the modules that are required as outlined by the psychology program standards by MQA. So this would be the compulsory modules that you're seeing at the top. So we've got adult psychopathology, child and adolescent psychopathology, psychological assessment, which is very important. Then we also have got psychotherapy that's split into 2 parts, part 1 and part 2. Also clinical neuropsychology and intermediate research methods and statistics, cultural diversity, ethics and professionalism. And we also have a psychopharmacology paper, as well as crisis intervention and addiction. So these are our compulsory modules. Yeah. We also have got research project modules that students have to go through in the program. So research project 1, 2, 3, it doesn't mean 3 different projects. That's the common question that we tend to get. It's actually one independent project that students work on throughout the program. So research project 1 would be the proposal stage, project 2 would be the data collection phase, and project 3 would be the report writing phase. Yeah. Then we also have got elective modules. So students are required to complete 3 over the period of 2 years. So we've got modules like group work, theory and practice in family therapy, systemic therapy for couples and family, play therapy, grief and bereavement counseling. So from time to time, of course, our aspiration, our hope is to be able to expand on this range of options to meet the contemporary needs in the industry. Right, so we believe that it's very important to, stay updated and stay abreast, right, of what's going on in the industry. So that would be developed along the way, right? But that also it doesn't change the requirement as of now. Even though there are more, it only means that there are more options for students to select from. They only would need to ultimately still complete 3 in order to graduate from the program. Yeah. So at the bottom would be practicum, which is just such an important component of training in clinical psychology. We've got 3 parts of practicum, practicum 1, 2, and 3. Practicum 1 would be internal. This would happen in our Psychology and Counseling Learning Center within IMU itself, which students will be supervised by internal faculty. And we also have got practicum 2 and 3, where students will be, and this is our external practicum, so students will be sent out to partner organizations, and that will consist of hospitals, NGOs, private centers, community centers, right? And they'll be supervised by qualified external clinical supervisors, right? So all this would extend across 2 years for full-timers. There's also a part-time option that would run across 4 years, but we would strongly encourage students to do it full-time if possible, simply because it's a program that demands a lot of your focus, energy, attention, commitment, and the chances of successfully completing it, we foresee that that will be higher if students take it on as a full-time mode, right? So moving on. So what would be, if you ask what would be the unique points of the program at IMU, we would say that it would be these 5 that you're seeing over here. So as I said earlier, all programs that are accredited by MQA would meet a certain standards, right? That is a must. But how each program is being implemented, there may be slight variations, right? So we can comment specifically on our program at IMU. These are the 5 areas that we would really focus on in our program. So secure clinical placement sites, and this is done through collaborations with hospitals, community partners, NGOs, private practices that I've mentioned earlier, and this is to enable students to fulfill the external practicum hours. So it's not, the responsibility won't fall on students to go and scout for appropriate placement sites, but rather this is something the program would cater to students, right? And comes with that would also be emphasis on a good case mix, and this also has to do with the secure clinical placement sites. By securing, a variety of these placement sites, we also believe that students will be exposed to a wider range of clinical cases of varying severity across different populations and settings. And this would also allow our students to be more work ready by the time they complete the program, right? And the third point here, engagement of fully qualified external clinical supervisors. And we are looking at supervisors who have got minimum 4 years of relevant clinical experience. And of course, experience is very important. Direct clinical experience on the part of the supervisor is important. But because just because someone is a experienced clinician, it does not necessarily translate into the person being a good clinical supervisor, right? So we also would want our supervisors to have received structured clinical supervision training, and this is to ensure high quality of supervision received by students. So the fourth point here, I would say, relates very closely to point 1 and point 2 as well, and that would be interprofessional collaborations experience. And this is to really foster skills in multidisciplinary case management. So as a clinical psychologist, we definitely can't work alone, right? We have to collaborate with other mental health professionals and also other healthcare professionals. So of course, collaborations with psychiatrists is very common. General physicians, pediatricians, counselors, yeah, of course, we can't leave that out. And many other professions, speech therapists, occupational therapists, physiotherapists, nutritionists, dietitians, yeah, and that is something that we want to hone in training itself, right? So the spirit of really collaborating and being able to communicate effectively, share knowledge, and benefit from each other's expertise is something that we really would like to foster among trainees while in training itself, right? Because as much as possible, we want our training program to mirror what's happening in real life. Yeah, and the reality is that multidisciplinary case management is just very needed in the profession. Yeah, and lastly, and very importantly, an emphasis on trainees' wellness. So in the helping profession, it's very easy for professionals to suffer from compassion fatigue after doing this for a period of time, right? I mean, you're seeing severe cases sometimes, and these are patients who are rather unwell, right? And how does that impact on our trainees? This is something that we think about closely, and because of that, we also incorporate peer supervision practices and workshop on self-care for our trainees. And because self-care is really, it's really mandatory in our profession. It's not a luxury. It's not a bonus. Like, you need to be well enough and take care of ourselves before we can actually take care of someone else. And that's what we would like to hone in our trainees as well. Right, so that is on the unique points of our program at IMU. So the psychology department at IMU also has got a Masters of Counseling program. Yeah, and this is just a quick overview on the key differences between our Master of Clinical Psychology program and also the Master of Counseling program, which is already it's been running for a while now. Yeah, so just a quick comparison. So both clinical psychologists and also counselors, yeah, can offer services. They are mental health professionals, and both can offer services to help improve mental health. However, there are slight differences in our areas of focus. Yeah. So in terms of entry requirements, the Masters of Clinical Psychology program only takes in applicants with a background in psychology. Yeah. So an undergraduate degree in psychology is needed. Whereas in counseling, the program takes in applicants from a variety of background. Yeah, so it's not a must to have a first degree in psychology in order to get in. So the clinical psychology program is designed to train future clinical psychologists, right? So by the time you graduate and you get registered with the Allied Health Professions Council, then you can practice as a clinical psychologist. The counseling program, on the other hand, is designed to train future licensed professional counselors, yeah, who are eligible to register with LKM. So the focus of training would also be different. Yeah. So for clinical psychology, again, going back to the core skills that I talked about earlier on in the session, yeah, assessment, diagnosis, treatment of mental health disorders. So we are really training our trainees to be able to deal with psychopathology, right? And different types of cases, whether depression, anxiety, PTSD, and so on and so forth. Whereas in the counseling program, the focus is more on addressing, social, emotional, relational issues or other life stressors. And, sometimes people may have this preconceived idea that, one profession is more important than the other, but it's not fair to say that, I would say. Yeah, it's just different areas of focus and different ways in contributing towards the mental health towards the mental health scene locally, right? So a lot of times before a person's condition escalate and worsen, right, they could have actually benefited from, preventive kind of care, right? Let's say, someone is very stressed out, and before the stress actually starts really taking a toll and the thing just, gets more serious, actually counselors play a very important role in intervening and helping the individual cope with the stressors more effectively. And a lot of times, if the condition is, if we nip it in the bud in time, it could have been prevented. Yeah, so counselors also play very important roles. And ultimately, if you ask me, which profession is more important, again, I don't think it's a fair thing to say, but rather, where would your passion lie? That's what I usually ask students, where do you see yourself? What kind of population do you see yourself working? How would you like to contribute to the mental health scene? That is the more important question, rather than which profession is, more important, so to speak. Yeah. So coming back to this, the last point here. So what would be the difference in the area of focus? When I say that, I'm talking about the population. Yeah. So the clinical psychology program would focus more on working with individuals with psychopathology or serious mental health disorders, whereas in the counseling program, there will be a stronger focus on working with individuals who are generally healthier, with fewer pathological mental health problems. Right. And that is also equally important. Right, so this would be a quick glance at the key differences between these two programs. All right, so the next section, I will just segue into talking about, so what are the work options with a master's degree in clinical psychology? Yeah? Where do graduates find themselves going towards after a master's degree in clinical psychology? So a very important question to ask oneself would be, which pathway would you like to take? Yeah, so in a very generic sense, right, we can kind of think of it this way, right? Would you really venture more into the world of academia? And when I say academia, that would be, teaching and or research, right? So teaching positions in higher education, like lecturing, typically, the focus would be in teaching, but of course, there's also a component of, research that's involved in many lecturing jobs, right? And there are some people who focus predominantly, or just research only. That's also possible, right? So is academia a path that you like to venture in, or are you more interested in practicing, right? When we say practicing, that would be really seeing clients, or sometimes more consultancy kind of work, right? Or would you rather a hybrid mode? Yeah, when I say hybrid, it's a mixture of both academia and practice, right? So this it may look like it's getting the best of both worlds. To some degree, yes, but later on, Dr. Serena and I will also, let you in a bit on some of our more personal experiences or observations about how this usually plays out in the industry, right? So, but generally, this is a good start for you to think, yeah, which route is more of your calling, where are you gravitating towards, right? And generally, that would also tie into the potential work setting. Yeah. So a lot of times, I would tend to tell students, you don't always know exactly where you're going to land yourself in, right? But start with a general direction, right? That's usually good enough, and be flexible enough to, really explore and review and see how you feel about working in these different paths, right? But these are the general work settings. Yeah, so let me just start from the top. So hospitals, so when I say hospitals, it could be private or public hospitals. Yeah, so with that, sometimes some clinical psychologists can be engaged as a visiting consultant. Visiting consultant meaning to say, you come in and offer their service on specific days or specific time slot. They're not necessarily there full time, right? So that's one possibility. Or sometimes a clinical psychologist can also be employed full time in that hospital. Yeah, but from what we observe, I think usually in private hospitals, the inclination is usually to hire practitioners with more experience, who are really able to, take on the caseload at the hospital. So that's what I have observed so far, with private hospitals. And then there's also clinics, right? So clinics, sometimes these are private clinics that are offering psychiatric services. And as part of that, sometimes clinical psychologists are also involved. There's a role for that within a setting, within a private clinic, psychiatric clinic. And then there's also private psychological centers, and you probably see quite a number of them coming up, especially if you live in the Klang Valley area. I think this is a location where most of the clinical sites would be based at, compared to other regions of Malaysia, I would say. Right, so in private psychological centers, sometimes there may be full-timers, or sometimes, associates that are not necessarily employed at the center, but are associated with the center, and maybe sometimes cases are referred to them as and when the need arises, right? And then going to the left, there's also consultancy firms. So usually one can be hired in the position of a consultant or a form of service provider, right? And on the left, further up, we also have got business owners. So by that, I mean, setting up your own private psychological center is also something that is possible. And basically, moving forward, if you're registered with, if you're Malaysian, you're registered with the Allied Health Professions Council, there's nothing really that's stopping a graduate to a fully qualified clinical psychologist to go ahead and do that if that's their calling, right? So we also have got research institutions. So I've said earlier, some people, may just predominantly deal more with research work. They feel that that's their calling, and sometimes research institutions would have vacancy for such positions, right? And then training centers as well, serving as a trainer, really providing training in mental health, right? And then moving down, NGOs or community health centers, there are different NGOs serving different populations in Malaysia, right? And usually these are, depending on the NGO's vision, mission, they may serve, they may have different interests, right? And usually, caseloads can be quite high over there, simply because some places offer it on a pro bono basis or at a really reduced rate that's a lot more affordable, right? So there are usually vacancies for qualified practitioners in these settings, right? And then moving to the left top, we also have got educational institutions, and by that, I'm referring to colleges, universities. So in the position of a lecturer, sometimes just a researcher, right? Or sometimes in a lot of universities, there's also a psychological center, right, within the university, and usually there may be vacancies for practitioners as well, right? So these are the general potential work settings for a master's degree holder in clinical psychology. So I've talked about, the general kind of work scope, job scope for someone with a master's degree in clinical psychology. Oops, I'm sorry, it's missing a Y over here. Never mind, let's just move on. Right, so what are some common thoughts that we tend to hear among master's degree holder in clinical psychology? So a lot of times, right, I think after people have graduated, and this is purely based on our observation, after people have graduated, probably got into practice or got into teaching or research, whatever it is, it's quite common for, I think, clinical psychologists in the industry to start thinking about, hey, so what is next in store for me? Am I happy to just stay right where I am with a master's degree? And if not, what is next? for me. Yeah. So let's just start from the far left. Yeah. Should I further my education? So I think, after a number of years in the industry, it's quite common for us to think that way, or hear of peers who think that way. Is this, am I done in terms of education and training? And do I just carry on with where I am right now? So comes with that, is the question of, okay, if I do want to further my education, what are my options, right? Dr. Serena, I think this is something that we do tend to hear. And the common question asked is, well, if you've already had a master's degree, the next thing, if you right above the hierarchy would be a doctoral degree, right? But there are also different types of doctoral degrees, right, in our field. So one can opt to do a PhD, yeah, which is really in a more traditional sense, someone who, is more interested in academia, yeah, and research. So usually the focus in a PhD program in psychology has got a strong focus on that, and probably not so much in terms of practice, right? Usually, people with a master's degree in clinical psychology get, qualified to practice with that master's degree, and then feel that, hey, I feel that I'm going to venture into the area of academia, and I feel that, what I have right now doesn't fully equip me to be a good enough teacher or researcher, and that's why people decide to do a PhD program, right? But for those who are not really interested in academia, there's also an option to do a doctoral in clinical psychology that is more geared solely towards practice. Yeah, so there's we've got things like PsyD program, right? And this would be the programs that are usually American based, right? Usually in the USA, their programs are named PsyD. And in the UK, there's also the DClin side. So again, what is the difference? Yeah, PhD, as I said earlier, is really more rigorous towards research. Yeah, and they are really ideal for students who are not just interested in clinical practice, but also in research and academia. But we also have got a certain fraction of us, right, Serena, and maybe quite a number, I would say, in the industry locally, who feel that, okay, I'm done with that. I don't really want to do any more research. I've done my master's degree. There's a component of research over there. I'm done with that. I really just want to focus on practice, but I also want to upgrade and develop myself further in the area of practice. Then there are these options of PsyD and DClin side. So in these programs, typically there's more of an emphasis on practice, right? More hands-on work, really dedicating more time to practice rather than, research or academia per se. Right.
Yep.
So what was your experience surrounding that, Dr. Serena, like based on, your conversations with peers or what you've seen?
Right. So for those who actually went through that route of the PsyD or the DClin psych, they typically went through it straight from masters into that. I mean, the university of their choice, whether back in Malaysia, this option wasn't available, I think, before it's only recently in the last few years.
Yes, right?
Yeah. Before that, it wasn't available. So people would take that option up in the US or Australia, or UK. So there were these few options that were the popular options. Yep. So they would have opted for it from the start. So they wouldn't have finished masters, they would have gone straight into that route, and it is intensified training hours and program requirements. So it's like one level up straight. So let's say if master's program takes 2 years, then this one would take maybe 4 years or more. And I think the main feature is the case mix. From what my peers who've done this would say, they would have been placed at different hospital settings or different clinic settings, and these are based on the sharing of our peers, our senior peers in the field who studied overseas. Yeah. So in the Malaysian universities that offer this option, it's just extended years of training. Yeah.
And it's even more competitive, right? If you talk about master's
Mm-mm.
degree here being competitive, I think to get into a doctoral training program abroad,
Yes.
it is highly, highly competitive because these are
Yes.
really prestigious
And
programs.
really limited spaces.
Yeah, very limited spaces and
Yep.
hardly any sponsorship to get in for international students, as far as I'm aware.
Yes.
Yeah.
Correct.
Yeah, and intensive, requiring a lot of your time, dedication, and focus. So dialed up from whatever you're doing at the master's degree level. Yeah,
Yeah.
right. And we also have, right, I'm moving to the next bubble over here. We also have got peers that say, you know, I still want to learn more. Really, that spirit of wanting to learn and expand is there, but not really interested in a conventional, not really
Yeah.
interested in a formal academic degree per
Yep.
se.
Yep.
Which basically means I don't want to do a doctoral degree anymore. And
Right.
I think from what I see, I think these are peers who are really very enthusiastic about attending workshops, conferences, symposiums, right? Like as part of
Mm-hmm.
continuous professional development.
Yep.
And there are
And
actually a lot
upskilling. Yep.
upscaling. That's right. That's right.
Yep.
And I think typically these are people who are comfortable staying in practice, right?
Mm-hmm.
But they also don't want their skills to just stagnate, and they develop an interest in specific kind of treatment modalities or specific population, and they
Yep.
really just go ahead and pursue further, sometimes certification courses. I think I've heard
Exactly.
of some doing
Yes.
it in like play therapy, sometimes like expressive arts and
Expressive
things like
arts related,
that.
drama therapy. I mean, the other courses that are not typically offered within the Masters of Clinical Psychology program. So they want to add on to their repertoire of skills.
No, right. I
Yeah.
think I know from I think my own experience as well. I think my initial few years of practice, it was something that I really look forward to. It's also a way to connect with peers, right? Either peers that
Mm-hmm.
you've already known, or sometimes, you know, if certain workshops were like international
Yep.
organizers, you kind of get to mingle around with professionals from other countries, which was really
Yep.
nice, I remember. But
Yep.
only setback sometimes, you know, they can be quite costly, isn't
Yeah.
it?
With
Yeah.
our exchange rate as well. So sometimes, I mean,
Mm.
it's something we kind of like put aside as a priority in our development. We would keep aside, finances to
Mm.
help us with this regular learning and development. Yeah,
Yeah, that's
that would
right.
help a lot. Yeah.
Right. I think comes with that is also, you know, and that's also that's one of the perks of also joining a certain professional society, like MSCP. Sometimes MSCP also organizes certain
Yep.
talk sessions or workshops and usually members would enjoy it at a more discounted rate, isn't it? To
Yes,
support.
or a privileged entry where it's a special
Mhm.
guest invited from another country.
Yeah, that's right. So that also supports. It's really a support that I think most of
Yeah.
us would appreciate, right? To deal with the
Yep.
cost of training, right? So, okay, another one is also, hey, I feel like a lone ranger. I feel all alone working in XYZ, which is sometimes a reality in practice, right? Especially
Mhm.
smaller organizations where you're probably the only full-timer over there. It does get quite lonely sometimes, right? And I think, I don't know, what are your thoughts about that? Like, have you encountered peers like that?
Yeah, I think it really depends on the personality, right, and preference of the practitioner. Some people really enjoy having a quiet space and they don't mind working independently, right? But
Mm,
if someone is having these feelings of, oh no, I think I feel a bit like a lone ranger in this place and this place, and so then that need for um regular collective peer consultations and supervision
mm,
sessions are very important. So, and sometimes just having that hustle and bustle, in the center, and you may even have additional professions in that center or that clinic setup.
mm,
So that can really be very stimulating and very exciting. So,
that's right.
so for example, for me, I would prefer to work in a setting that has a few disciplines, right? So I have
Mm, mm,
psychiatrists, counselors, nutritionists, um, maybe certain specialists as well. Yeah,
Mm.
general physician. So it would be great because that setting allows me to actually refer cases as and when necessary, and also those colleagues in that setting do refer to myself. Yeah,
Precisely.
and
Precisely.
then
And I
we
think
we manage cases together, right? So very
yeah.
collaboratively. Yeah.
Right. I think I echo that as well. I think that kind of collaboration, whether interprofessionally or even peer supervision among
Mhm.
qualified practitioners, I think we still consult with each other a lot.
Yes.
As much as we are already qualified and supposedly competent at what we are doing, but that kind of support is really essential to really thrive in the
Yep.
industry, right?
Yeah.
Yes, we've got a bit more over here also. This is our last slide. So my family questions my career choice. This is also not uncommon, isn't it? Given that it's
Yeah.
a blooming industry, and unfortunately it happens, but I think those who really stuck out and really
Mhm.
kept to it, it takes a lot of passion to stay, I would say, right? Especially
Yep.
those peers who actually started
Yeah.
getting the industry, the pioneers. We listen to their stories, and it really is about making yourself visible. And
Yep.
I think people like you and
Yeah.
I do it through talks, right?
Yeah.
Doing more
Yeah.
talk session. Some of our peers are very active on social media as well, psychoeducating
Yeah.
the public about mental health,
Yeah.
which is great. Oh, the
Yeah.
next one is interesting. Yeah, you wanted to say something?
Yeah, just as you were sharing, it just reminded me of my own journey as well. Back then, when I was an undergraduate student trying to choose what was my pathway, and then becoming more focused on clinical psychology, it was really not easy convincing my family. Um,
Mhm.
but I think I was very consistent in my desire to just go that direction. And so I think my family didn't really understand the nature of the work and just that
Mm,
career pathway, really. And
mm,
even so I went through but they supported me nonetheless. So as I went through my
mm,
master's and they saw me working so hard, then when I graduated, then I continued to, you know, get into practice and then also get into teaching. So it
mm,
took them a fair number of years to finally see that this was a real career choice. So my
mm,
time was a while back, and the industry was not so aware. People were not so aware of, right, in
mm,
our
mm.
local context, and
Not
not so
so well
visible
known.
back
Yeah.
then. Yeah, this is like more than a decade ago. So
Yeah.
really, those of you here with us today, fortunately, the industry has blossomed a bit more. It's definitely grown and progressed. Yeah, so we're a bit more visible. And as Miss Cheryl shared just now about the Allied Health Professions Act governing this profession, it's a very exciting move, and will become very well recognized. So
Mm,
and it's just something that, like she said, as we commune with one another in the field, in our professional body, we continue to encourage one another. So
mm,
a lot of
mm,
awareness helps. I think awareness is a huge responsibility of each one of us.
mm,
In fact, I've just been elected to be part of the awareness team in the Malaysian
mm,
Society for Clinical Psychology, and so
mm,
I have to make time to write articles or to appear in different events and to just
mm.
continuously talk about it as part of the profession. Yeah.
Really like
So
an
it's
ambassador. You kind of have to be an
exactly
ambassador for the
all the
profession.
time. Yeah, yeah.
Yeah, it's
But I love
okay.
it. I'm happy to do so.
Yeah.
Yeah,
It
yeah.
comes to this, right? Work-life balance possible in this field. I think really, and in those of us who are in hybrid mode, right?
Mm,
One foot in academia, the other one in practice, there really it takes a lot of time, right? You can't
yep,
deny that. We hold a
yep.
full-time job and we also do clinical work. And it does take up a lot of your time, but I think with the right passion and time management, it's not something impossible. Yeah. I'm also aware of
Yeah.
the time. I'm seeing a lot of questions pouring in, so I'll just address the last two very quickly. So I
Mhm.
don't want to work in one setting only. What are my options? So I think freelancing is also something
Yep,
in our industry, right? So we've got
yep,
peers, and I think we tend to see that in
yep.
some are really established professionals, practitioners really. Some are newer in the industry. I
Mhm.
think doing freelance work, right? Some may be teaching part-time, and then
Exactly. Some
as
are
an
in hospitals,
associate.
some are
Yeah.
in private centers, so they could actually do 3 things or 4 things.
Mm,
So
mm.
yeah,
Takes a lot of enthusiasm to do it, but it works out for some, isn't it? And you
yes.
see them doing that for
They
years.
like the mixture of the nature of
Precisely.
work and the setting. Yeah.
Precisely. Okay,
Yeah.
and the last one over here. What if I want to work abroad? I think this is a question that we get a lot, right?
Yes.
So again, I think each country would have their own regulations surrounding who and what kind of training background would allow them to be a practitioner. And I think what we can say is that, you know, if a program is accredited locally and graduates are able to apply with the Allied Health Professions Council and be registered, it doesn't mean a parallel, you know, automatic registration with any external, you know, not external, sorry, any other bodies abroad, right? And I think that the onus would fall on the practitioner to actually find out what are the requirements needed in order to qualify to practice in all these other localities. I
Yep.
think this is something we
It's
have
best to go to
yeah.
that the direct authority in that country because it does vary very much, and sometimes their requirements may differ slightly from year to year or time to time.
Precisely, right?
Mm.
So I think that takes us to the end of our formal
Okay.
presentation or chat,
Right.
or you like
Thank
to
you
call
so
it.
much. Thank you so much,
Yeah,
Cheryl. Really,
yeah.
I mean, I've learned so much. I mean, yeah, just
Yeah,
enjoyed listening to you, and I hope all of you here as well enjoyed what we've shared so far. So now we will address the few questions that have come up. All right. Okay. So the first question is, I'm unsure if
share this.
sure.
Yeah, go ahead.
I'm unsure if counseling or clinical psychology is best for me. What is the difference? Okay.
Maybe
I
I
think
can.
yes, that slide that you
Yeah,
had. So
yeah.
this
Let me.
question actually came in before that slide came up. I noticed the
Oh, give me
timing.
1 second.
Yeah,
Oh,
but
okay. No
we'll
wonder.
just recap very
Yeah,
briefly.
just let me just share the slide. I think it's easier reference, right?
Sure.
Okay, I have to go back. Give me a moment. But I think it's not an uncommon question, what
Yes.
you've asked. Here you go. Right. So I think, again, both are mental health professionals, as we said, right? And the entry requirements may differ across these two programs. And ultimately, it is the focus of training. And that links with the scope of work and the kind of populations that you're going to be working with eventually. So clinical psychologists, you cannot escape psychopathology. If you qualify as one, you would qualify in these main pillars of assessment, diagnosis, treatment, or psychopathology, right? Whereas in counseling, as I said earlier, the focus is more on healthier individuals, typically with fewer psychopathological problems. Yeah. And again, they also serve a very important role in the mental health system locally for reasons that I've mentioned earlier, right? It really depends on your passion. You know, some people are really clear from the get-go. I cannot see a patient who's depressed and anxious and really unwell all the time. It's just not my personality. I can't see myself lasting in a profession like that. And they go with counseling and they do really well in it, right? So it really go with what you can foresee yourself doing, right?
Exactly.
I think sometimes people have got this. Yeah. You wanted to
Just
say
adding
something?
on to what you've just shared about, that's also one measure, like because of the nature of the cases that clinical psychologists would be working with, it would, the duration of treatment will be much longer, typically. Yeah. Having said that, so those who are counselors, they could also take cases that may need a bit more long-term care, but the majority of their cases would be a little bit more shorter term. And so that can be something very fitting with what they want to do, right? They're like, I want to do more day to day. So that really is one indicator as well.
So I think some common cases that they do would be, you know, some students who are going through academic stress, for example, life transitions, marital issues, sometimes an adjustment through, you know, just a difficult adjustment, a transition period that's really very stressful. And, you know, counselors, a lot of counselors that we know are really passionate and they do really well in that area, right? It's really their forte. And so we hope that helps whoever asked that question.
Thank you. I'll move on to the second question. Okay,
Sure.
so the second question, I can take this. So the graduate trainee program, GTP, was recently launched by IMU. Is it applicable to MCP as well? Thank you. So I'm so glad to be able to answer this question. I actually sit on the committee of the university's industry partnership. So and this has come up as well. So the graduate trainee is referring to an undergraduate who has just freshly become a graduate. So that GTP is primarily focusing on fresh graduates from the undergraduate program. And once the memorandum of understanding is signed with the different industry players, then different programs will have those options, and the duration of that would differ from company to company. So whether will it apply to the master's programs, the postgraduate programs, at this moment, no. Why? Because typically, especially let's say MCP, which is a skills-based professional program, you will already be getting a lot of industry training within the program. You have so much practical training so that when you graduate from your master's, you're ready to go. You don't need another trainee program. Your program already covered you with so much clinical supervision. So that it would be the reason why it is especially not applicable to MCT and also the MOC. Okay, so your program covered you and trained you so that when you get your cert, you're ready to go, you can get a job straight. Okay, hope that helps.
Thanks, Dr. Serena. Glad to have you here. They're lucky
right.
you're here.
Yeah, I'll move on to the third question, or you want to add on to that?
Oh no, I think you've said it while I was scrolling. I think I was just trying to say that, you know, the practicum is really a good 25% of the entire Masters of Clinical Psychology program, which is really very solid hours going to clinical training. Yes,
okay,
let's go with the next
question. Is someone who's interested in our journey on what motivates both of us to respectively pursue this Master of Clinical Psychology after our degrees. In the interest of time, perhaps I'll let Ms. Cheryl answer this one.
Sure, I'll do a quick one. We can go on, right? The both of us can go on, but I'll just keep it short. So I think I was always interested in, you know, how human mind works, you know, human behavior, why people behave the way that they behave, and that's exactly why I started with a bachelor's degree in psychology. But I didn't necessarily have clinical psychology, like definitely just that on my mind, right? I did have some teaching experience also, not in academics. I was teaching in a different area while I was doing my bachelor's degree, and that kind of motivated me. I thought I was going to get into education, and because of the population that I dealt with at that time, we have come across people with special needs, and I thought, hey, you know, I like teaching, and you know, this is something that intrigues me. I got into special needs as my first postgraduate, and along the way I also realized that, hey, a lot of times you can do a lot of intervention for the identified patient, the child, but if you don't have parents on board, you know, none of the interventions are, you know, it's not going to be sustainable. You're not going to get the benefit. It's limited, exactly. And that kind of expanded my interest in, you know, working with, you know, other people who are involved in supporting the individual. And that's where I understand further about, you know, caregivers, depression, caregivers, anxiety, and eventually it kind of segue into psychopathology. I think, you know, in short, that's how I got into clinical psychology. And you know, my passion still keeps, it gets renewed over the years, and my career also expands in different direction for the better. That's me.
Thank you. That was such an inspiring sharing. Sorry, I will just have to move on to the next question. I would like to be able to address the last two questions. Okay, so next one is about research being a bit daunting. So would there be a guide or support for those who need it? Great
Understandably,
question.
Good question. So this is the right slide. So if you see under compulsory module, number 7, intermediate research methods and statistics is compulsory. Although, you know, people with the first degree in psychology typically would have had exposure to statistics in psychology, quantitative methods, qualitative methods even for some programs. But this will be a more advanced level of research methods to give you the foundation, right, so to speak, to pursue research at the graduate level. But of course, as you get into research project 1, 2, and 3, it is a progressive module, as I said earlier, right? It's not like 3 projects, not that overwhelming. It's one project that you work on progressively and incrementally, working closely with your supervisor. And students will also have co-supervisors in the process who will be supporting their work. So of course, you know, it's done across 3 different semesters. And that kind of supervision support is definitely part of the curriculum. right?
Yep.
Hope
And
that was
to make
something.
it less daunting, and the support structure that's in place is for MCP, there'll be two, and most master's programs, they are required to have two supervisors. So not just one, you have
Yep.
a primary and a co-supervisor. Okay?
Yep.
Yep.
So
All right.
perhaps one who's like really the direct content expert, and maybe
Yes.
another one could be a methodology expert as well. So the support
Exactly.
structure is there.
Is there. Yep.
Yeah.
Okay.
So I hope that answers as well. Yeah.
Right.
Is
And if we
anything
don't have
else?
any more new questions, we'll have just the last one for tonight. So what is a typical day-to-day for a clinical psychologist? Oh, that's nice
You
to
want to
share.
go?
Yeah, I can just give
Yeah.
you a snippet. I think
Yeah.
as Ms. Cheryl has shared very comprehensively just now, it really depends on the setting that you're in. Okay.
Mm.
So if you're the kind that loves variety of work, so you might choose the hybrid mode, right? The academia, research, and then practice.
Mm.
And then your days will be full because you could be holding a full-time job or a part-time here and there. And so your day-to-day could be fixed, like one day's teaching, one day's research, one day is practice, or it could be a integrated combination of the three. Okay. If someone is a full-time practitioner in a hospital setting, let's say, their primary role would mostly be to see patients, clients for assessment and therapy cases. They may also do maybe ward visits. They may also do outpatient consultation as well. For hospital setting, there's often awareness talks as well. So there's these, yeah. So but that would be the focus would be practice because that's in a hospital setting. Okay. Yeah.
So if that excites you, like doing a lot of things, I always joke, right? We used to call some of our peers like octopus. You're doing multiple things.
Yes.
But it works for some of us. It's exciting. It keeps us going. It really has to fit what you want, your personality. So I think, are there further questions? I'm just looking at the chat and.
No,
Okay.
I think that is
All
it for tonight.
That's it. All right. So I think if that's no more further questions, that wraps up our session for today. And we hope that this gives you some idea, shed some light for those of you who are considering a career in this path, or give you more insight if you are already a trainee in an existing program, right? So all the best to you all, and thank you very much again for joining us this evening, and have a restful evening.
Yes, and good weekend ahead, right?
Yes.
Up soon. Okay. Thank you very much, Ms.
Thank
Cheryl.
you. Thank you,
to all of you
everyone.
tuning in. Bye-bye.
Bye-bye.